Good morning, everyone. My name is Terence Kernaghan, MPP for London North Centre. I'm also joined this morning by Dr. Cheryl Forchuk of Lawson Health Research Institute and Laura Pearson from the Ontario Peer Development Initiative. I want to thank everyone for joining us bright and early this morning to discuss my new private members bill, Bill 277. If passed, this bill would extend the assistive devices program to cover mental health devices and any associated data costs with them. This would include coverage of devices which allow patients to virtually access medical and counseling appointments, relay heart rate, physical activity, and sleep data to healthcare providers, and automatically dispense medications on schedule. It would keep people safely in their homes, receiving care, instead of waiting in hospital hallways. It's critical that we pass this bill because too many people in the province of Ontario do not get the mental health supports that they need. There simply aren't enough options for support, treatment, and care. This was true before the pandemic, and it's particularly true now that the number of Ontarians struggling with mental health issues is on the rise. Data from the Ministry of Health suggests that London's healthcare system has more mental health patients than beds available to them. Before the pandemic in 2009, at Victoria Hospital, data suggests that for 179 out of 181 days, there were more mental health patients than beds. This imbalance leads to those with mental health needs waiting for days to access care, sometimes in hospital hallways, or even going without the care that they need entirely. In fact, some Londoners have waited up to 6 days before receiving care, despite the incredibly urgent nature of their mental health crisis. It's clear that underfunding our mental health services is contributing to the hallway medicine crisis, leading to experiences where mental health patients are stuck in hallways, and as a result, their mental health actually becomes worse. We've all heard stories of patients waiting in hallways with no privacy, no access to washrooms, and where the lights are on 24 hours a day. There's no question it would be a safer and a more positive experience for these folks to receive mental health care directly in their home where possible. And so this bill aims to tackle those issues head on. First, we have to connect Ontarians living with mental health challenges to help them lead fuller and safer lives. Technological devices can support mental health needs and their care and treatment. We have to ensure Ontarians experiencing a mental health crisis are not left stranded in a hospital hallway or bed because our healthcare system simply doesn't have space for them. Even more importantly, we have to give those Ontarians the tools they need to avoid reaching that crisis point. By providing mental health supports right at home with assistive devices, this bill can help people lead fuller, more independent, and safer lives, and help people end the cycle of crisis and hospitalization. That's why I was thrilled when Dr. Cheryl Forchuk shared with me her research that helps us confront these issues. I'm going to turn things over to Cheryl now, whose research, passion, and vision were instrumental in creating this bill. Take it away, Cheryl.
Thank you so much, Terence. And I mentioned before, I had just reflected as since I am both a nurse, registered nurse, as well as a scientist, how appropriate it is that we meet today during Nurses Week and on Florence Nightingale's birthday, 101st, 100 if we figure because of the pandemic, 1 year doesn't count. She was both a nurse and a scientist and used data to create change. And a lot of those changes and reduction of deaths during the Crimean War was as a result of actually using data. So very appropriate on her birthday to honor that memory with data. Before we go to it, let's talk just for a minute about the assistive device program. This is a program that was introduced quite a while ago, almost 3 decades. And it provides quite a few devices. If you go to the website, you'll see that there's over 8,000 devices that people living in Ontario can access through this program. Everything from things to supplies to control diabetes, various mobility devices, canes up to very elaborate wheelchairs, breast prostheses, post-cancer, so quite a range, over 8,000. But if you look at that list, you'll see none of them relate to mental illness. And the reason is because the legislation itself establishing the program says it's only for physical disabilities. So it actually explicitly excludes mental illness. Now, you may think, well, that should be a charter issue. I mean, we don't discriminate on the basis of illness. However, we can give a bit of slack in thinking, well, 30 years ago, people probably couldn't envision that we would have technologies available to support people with mental illness. But today we actually do know that's true. One of my roles with Loss and Health Research Institute is as the group leader for mental health research. And we've spent over a decade looking at how can we harvest the potential of newer technologies to support people and allow them to remain more at home rather than coming into other levels of care, such as long-term care or hospital. And one of the first ones we did, when you come up with a new drug, you always start with the medium dose. And then once you know that the medium dose works, you kind of look at what would be a light dose and who could get by with that and what's a heavy dose. So we started with studies looking at that medium dose, which was basically often cell phones with an app that was a communication device with the person with the mental illness and their care provider, where they could set up things to monitor their symptoms for early intervention. So their healthcare provider would be alerted, they themselves would be alerted, get prompts and reminders. So one of the first studies we did with that, we had 400 people enrolled in that study. Half had the new way of doing it, the other delayed by 6 months. And what we found was we actually could prevent crises because people could identify earlier what the problems were and get earlier intervention. That resulted in fewer hospitalizations, fewer trips to the ER, and interestingly, even fewer arrests. Mental illnesses are probably the only illnesses that when things go bad, sometimes it's not the ambulance that arrives, it could be a police car. So all these things were reduced such that even in the first 6 months, it was cheaper than usual care. And I say even in the first 6 months, because that included the training costs for staff, the purchase of the devices, and the training of the patients. And yet it was still cheaper within that first 6 months. After that, when the devices are in hand, of course, it would be far cheaper. So that would be like a medium dose. We've done studies with light doses, which instead of having all these more elaborate apps, could be a text messaging solution. And we've looked at things such like a group home study, for example, where we use a text message solution to move from group home to independent living with prompts and reminders, affirmations, a much cheaper, lower dose. The event that Terence most recently attended was for smart homes, which would be a high dose. And Laura also was present for that event. So this was for people with very long-standing, serious mental health and often physical problems. In fact, most of the people had at least 3 chronic illnesses and were very much at risk of not being able to stay in their home because of the multiple health problems that they were handling. So in this case, we didn't have them simply go into a device. We had the opportunity for the message to come directly. This was people that because of memory, organizational issues, might not remember a password. So I say it's not typical. This is the few people that require a higher dose. And we did that as a demonstration, setting up 13 homes for that one. So much smaller because it was a proof of principle given the lack of research on smart homes in healthcare. But interesting, and so that's where we had like Fitbits in terms of activity to monitor changes in sleep. We had the potential medication dispensers, a number of devices that we linked securely behind the hospital firewall. So both the person with the lived experience as well as the staff could again access information, have early intervention. But again, consistent with all our other studies, we saw compared to their past patterns of use, fewer visits to the ER, fewer hospitalizations, et cetera. So even this group that was very much at risk of going into hospital or long-term care was able to remain at home with these new devices. So we can certainly understand that why 3 decades ago people did not think of assistive devices being part of mental health care as well. The assisted device program gives us a framework. It has to relate. I can't just decide, hey, I'd like a motorized wheelchair. It has to relate to a problem I have. It has to be prescribed by a physician. It's part of the plan of care. There is a process for looking at the evidence for various devices. But I think now that we're in the 21st century, not just the 20th century, we have to understand there can be no health without mental health. If the pandemic's taught us anything, hopefully that's one of the lessons we learned. And in this 21st century, we know that these new technologies are available to support mental health as well as physical health. And we really need legislation that does not discriminate based on type of disability. So thank you.
Well, wonderful. Thank you so much, Cheryl. This type of research is absolutely critical to show that technological devices can support mental health care and treatment for Ontarians living with mental health challenges. Early intervention is absolutely fundamental to address mental health care. I now want to turn things over to Laura Pearson of the Ontario Peer Development Initiative to discuss the ways this bill will help those with mental health needs and our healthcare system alike. Thanks for joining us, Laura.
Thanks very much. The proposed assistive devices program legislation will allow people to use technology more independently and to experience fewer mental health crises and hospitalizations, and engage in more social and meaningful activities, including work and volunteerism. The proposed access to technology, or legislation for technology, will also begin to address the inequitable access to health care, especially highlighted during our pandemic, and begin to address the social determinants of health. Ontario Peer Development Initiative applauds MPP Kernaghan for introducing this private member bill. The COVID pandemic forced our consumer survivor and peer support services to go virtual. Ensuring access to technological devices means individuals can better manage their own mental health and wellness and lead more independent and fulfilling lives, building their self-esteem and engaging in social activities significantly more. Thank you.
Well, thank you so much, Laura. It's very important that we pass this bill to give people living with mental illness a better chance at a full, independent, healthy, and safe life. Including technological solutions for mental health care in the assistive devices program is a big step forward in achieving this goal. So on this anniversary of Florence Nightingale's birthday, I want to thank Cheryl, Laura, and everyone else for joining us this morning. I believe we have some time to see if there are any questions.
And a reminder to any journalists on the line to please use the raise hand function if you wanted to ask a question. Okay, it looks like we don't have questions at this time, so thank you very much, everyone.
Thank you.
Thank you, everyone.
Bye.
Well,